Sam, am I on?
Good morning. I'm going to call the.
You got Miss Kale on me now. Uh-oh. I'm just kidding. Pull a chair.
I'm going to call the Cook County Health and Hospital System Finance Committee meeting to order. Will the secretary please call the roll?
Director Green? Present. Director Harrington?
Present.
Director Lowry?
Present.
Director Robinson is absent, and Chair Ryder.
Ryder is here.
You have a quorum.
Thank you. Can I have a motion to allow Commissioner Lowry to remotely participate in the meeting as a voting member?
So moved.
All right. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it.
Thank you.
Have any written or oral testimony?
We did not receive written nor registrations for oral.
Is there anyone, are there any members of the public who wish to offer any public testimony? Any members of the public? It does not appear that any members of the public want to offer any verbal testimony. The next regular meeting of the Finance Committee is scheduled for Thursday, May 8th at 10 a.m. The first action item that I have is would be, I don't know how to handle this because I don't know that it's on the agenda, but it is my understanding that it is Dr. Makaitis' birthday, so I would first ask for, in order to not embarrass Dr. Makaitis, a motion to dispense with the singing of Happy Birthday.
Thank you.
Or I can just make, Director
I
Harrington.
was going to second the motion.
Okay. Okay. I've made the motion. Director Harrington has seconded the motion. I am not sure that the motion is debatable. And I think we can do it by acclamation. So we're not singing Happy Birthday to embarrass you, but we just went through that whole process right there to embarrass you. So happy birthday. Yes, happy birthday, Eric.
Here, here.
So, all right. The next item is going to be. You should see the look on Debbie's face when I said I was going to introduce you. Yeah. The March 6th, 2025 Finance Committee meeting minutes. These are expected to be approved by the board at the April 4th meeting, so they are currently in draft form. They are being presented for the committee's consideration. Are there any corrections that need to be made to the minutes? Any corrections? Any corrections? Hearing none. Is there a motion to approve item 3A, the March 6th, 2025 Finance Committee meeting minutes?
So moved.
Motion's been made. Is there a
Second.
second? Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed?
Aye.
The ayes have it. Moving on, items under the Chief Procurement Officer. There's a total of 23 items. Approaching the hot seat now is our master of all things procurement, our Chief Procurement Officer, Charles Jones. Charles, you want to give us the high-level view before we start going through the items?
Yes, sir. Good morning, Charles Jones, Chief Procurement Officer.
Good morning.
Before you today, we have 23 items. 22 are contracts and procurement items, and one requiring responsible letters from the Office of Contract Compliance. We have back 15, 7 are in process, and one is an expenditure item. So with that, we can go to the executive sponsors.
All right. So first, items number 1 through 5 are going to be presented by Dr. Rudy Kamapoli, our interim chief medical officer.
Good morning,
Good morning.
Morning.
Chair, I'm Board of Directors. So I'll be presenting 5 contracts. The first request is to execute a contract in an amount not to exceed $4,782,870 as needed with Skytron and for the supply of operating room booms and other equipment for Stroger Hospital. So the one-time capital purchase is a 10-key project with a 36-month comprehensive coverage plan. Next. The second is a request to execute a contract in an amount not to exceed $1.8 million with Boston Scientific for the provision of Watchman left atrial appendage device by use of our cardiology teams. These are for atrial fibrillation patients to reduce the likelihood of strokes. So this is a 36-month contract extending through the 30th of April, 2028. Next. The third request is to execute a contract in an amount not to exceed $1,050,000 with KLS Martin for the provision of plastic and reconstructive surgery implants and supplies by use of our plastic surgery specialist. This is a 36-month contract extending through April 30th, 2028. The fourth request is to execute a contract in an amount not to exceed $803,341.20 with Olympus for the provision of scopes and other supplies. So it's a one-time capital purchase in a 48-month service plan. This is for use by the gastroenterologist at Providence Hospital. The last request is to execute a contract in an amount not to exceed $160,911 with Laradell Medical Corporation for the provision of mannequins and supply for the use of our simulation lab. This is again a 36-month contract extending through the end of April 2028. Thank you.
All right. Any questions for Dr. Kamapoli? Hearing none, thank you. Moving on to request number 6, being presented by Nicole Almero, our Chief Corporate Compliance and Privacy Officer.
Good morning. Happy birthday. Nicole Almero, Chief Compliance and Privacy Officer. Bass, Berry & Sims is the request for an increase for $92,000. We just did an extension, but we had an issue that we last year that we needed coverage for extra payments. This is a request for additional money.
Thank you. Any questions for Nicole?
No questions.
All right, thank you. Moving on to request number 79, being presented by Shannon Andrews, our Chief Equity and Inclusion Officer. Good morning, Shannon.
Good morning, sir. Good morning, Board of Directors. I have 3 items before you today. All are for materials management. The first one before you is a request to extend an increase with a vendor who provides our laundry and linen management services, Superior Health LLC. The request is for an increase not to exceed $7,237,000, and this will take us through April of 2026, allowing us to complete a RFP solicitation that's currently underway. The second item before you is a request for materials management to extend an increase This vendor, Cardinal Health, provides shipping, delivery, postal services, and OptiFreight. The increase is not to exceed $801,142, and this extension will take us through February of 2028. This is the first of two one-year renewals allowed by the contract. And the last item before you for materials management today really is a companion piece, if you will, to the linen contract. This is a request to extend and increase the contract for the service of linen control. It's our ScrubX surgical machines. The vendor here is doing business, IP81 doing business as Med1. The increase is not to exceed $315,200 and will take us to January 31st of 2026.
I have a general question. For all three contracts, do these vendors have staff on site, or are we working with them remotely? Because they don't need to do the work here.
For the first contract, for the Superior Linen contract, it is staff and linen. So they provide the staff in addition to linen and scrubs. For the third contract, it's actually a machine that the linen staff puts scrubs into the machine that then are accessible by card from our clinical department.
Thank you.
You're welcome.
Thank you, Shannon. Moving on to request number 10, finance, being presented by our Chief Financial Officer, Pam Cassara.
Good morning. We have one for you today. This is a request to extend and increase the contract with Centellus Performance Solutions in the amount of $249,009. This is software that we use to prepare our capital budget, operating budget, financial reporting, financial analysis, forecasting, and productivity. We are requesting to exercise the second of two one-year renewal options. Any questions? All right.
No questions for
Thank
Pam.
you.
Thank you, Pam. We'll see you in a little bit. Moving on to request number 11, being presented by Angela Banyan, our Chief Information Officer.
Good morning.
Morning.
This request is for IntelliRad, which is a vendor that we use that supplies imaging services for our patients on Cook County Portal. So when you go to your doctor and they do an X-ray, this allows you to those images to be uploaded so that patients can actually see the results. This is the request for new contractors. We are, again, doing business with them. We have their hardware already on site, which is why it's a sole source because of the proprietary software.
Any questions for Angela? Hearing none, thank you, Angela.
Thank you.
Request number 12, nursing, Dr. Dina Peters, our Chief Nursing Executive. Morning.
Good morning. This request is to purchase 36 ICU beds and 5 wheelchairs along with the accessories and also preventive maintenance contract for the next 5 years.
Any questions? Hearing none, thank you, Dina.
Thank you.
Next up, request number 13 through 16, our Chief Administrative Officer, Craig Williams.
Thank you. Good morning. First contract I have is for Kaizen Health. It's an extended increased contract for $5 million. We're asking for a 12-month contract extension, 7/1/25 through 6/30/26. Kaizen provides transportation for CCH as well as county care patients to appointments and also help with emergency room and hospital discharge trips. And this is our first renewal contract option on this contract. Imperial Parking is an extended increased contract for $3,131,003. We're asking for a 12-month contract. I don't anticipate using the full 12 months, but the 12-month contract would be 4/1/25 through 3/31/26. This is our vendor that currently provides parking management services at Stroger, Provident, and Core. We have an RFP that's been posted and we've scored, and we're just going through the finalization of that selection. So we want to make sure we just have enough runway in the current contract to make that conversion if we end up doing a conversion.
It looks like Commissioner Lowry has a question.
Commissioner?
Thank you, Chair. Thank you, Deb. So Craig, why is it you do not anticipate using the full amount? If you would just advise, that would be helpful. Thank you.
So we are likely to enter into a new contract either with this vendor or a different vendor that would be for a longer period of time upon the finalization of that RFP. So we'll continue to use a parking management service, but it may be different or maybe a new contract with this particular vendor.
Got it. Thank you.
Couldn't afford to run out of time on this,
Right.
the current contract, right? Yeah,
Thank you.
sure. Tech Refrigeration extended increased contract for $535,000, a 12-month contract, 4/1/25 through 3/31/26. They provide preventive maintenance and repair services to our patient care refrigeration equipment. Focused at Provident, we're doing an RFP for these services, and hope to make a selection during this year to move forward. And Interstate Electronics Company is an extended increased contract for $100,000 as a 12-month contract extension, 5/1/25 through 4/30/26. And this is focused on our current nurse call system at Stroger. We're actually in process of designing a new, and selecting a new nurse call system at Stroger with the vendor TBD, but this is to make sure that we can maintain the current system.
All right, thank you, Craig. Moving along to, we'll see you later too. Moving along to request 17 through 22, Stroger Hospital. Donica Austin Cathy, our Chief Hospital Executive at Stroger.
Thank you and good morning. Good morning, Chair. Good morning, Directors.
Donica.
Okay, the first one we have is an extend and increase contract with Mount Sinai Community Foundation doing business as Sinai Medical Group in the amount not to exceed $1,227,200. The revised contract period of 1/17/2025 through 1/16/2026. This vendor will continue to provide professional services for the radiology department, clinical support, as well as call coverage and radiology.
Yeah, see, this was an emergency purchase. So we didn't have people to do this, and we needed.
Yes, when we initially began the conversations, we had a challenging situation with our call coverage in radiology.
Okay, and the plans moving forward is to go out, do a broader search?
Yes, certainly to enhance and recruit our own radiologists here at Cook County.
Keep us posted.
Thank you.
Good luck.
Thank you. The next one is an extend and increase contract for Stericycle for hazardous waste and pharmaceutical waste in the amount not to exceed $840,000. The revised contract period of 4/1/2025 through 3/31/2026. This request is to allow the continued provision of service for waste removal, medical hazardous, and sharp pharmaceutical waste. The next one is an extend increase contract with Bayer Healthcare for Stallant syringes. The amount not to exceed $421,067.16. Revised contract period 6/1/2025 through 5/31/2026. The vendor will continue to provide the Stallant syringes used in CT, MR, angiography exams at Stroger, Provident, Blue Island, and Cermak. And next, we have an extend and increase contract with Tri-State Dental this is for our dental pharmaceuticals in the amount not to exceed $64,000. The revised contract period of 3/15/2025 and 3/14/2026. The vendor will continue to provide streamlined access to the high-quality products such as our Septicane, Articaine, Mepivacaine, Bupivacaine, and our Lidocaine for our dental procedures.
All right.
And next, we have an amend and extend and increase contract with AB Staffing Solutions for professional radiology staffing services in the amount not to exceed $8,884,617.72. The revised contract period of 1/1/2025 through 11/30/2025. The vendor will continue to provide services for the temporary placement of radiology personnel in CT, MR, ultrasound, nuclear medicine, mammography for the system. And the last one is an execute contract with MedSpeed. This is for our courier services for the laboratory in the amount not to exceed $1,650,000. The contract period is 6/1/2025 through 5/31/2028. The vendor will provide courier services for our patient samples, supplies, and reports that are coming from Providence, Cermak, and the clinics to the laboratory at Stroger. This vendor will be using the courier services also for vaccines that need to move about between the campuses, allowing for timely and secure delivery of those samples.
All right, thank you. Next on the list is coming back to Angela for another health information systems presentation or item.
Hello, again. The expenditure request before you, again, Angela Banion, Chief Information Officer. The expenditure request before you of $265,000 will allow CCH to pay GRM for invoices incurred post-contract expiration. This company provides off-site storage for several departments, as you can see, including employee health and medical records. GRM also provides the electronic and physical retrieval therein. CCH and GRM continue to finalize the new contract with terms that have been updated materially since their last contract. So we are continuing these negotiations for updated and mutually agreeable contract terms.
Yeah. How long are we required to maintain these documents on paper?
It depends on the actual department, whether it's HR or medical records or finance, coding, et cetera. So it just depends.
Right. Any questions? Thank you. All right. So, if there are no questions on any of the 23 items presented, I would accept the motion to approve item 5A or 4A, contract and procurement items containing request number 1 through 23, subject to completion of review by contract compliance.
So moved.
Motion's made. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
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 Opposed? The ayes have it. Now I'd like to move to the MBE, WBE report being presented by Charles.
All right, thank you, sir. So before you today, we have, as we round out FY24, we have the month of November that we're presenting, and then a full snapshot of the year in total. So if you look at the furthest two columns to the right there, the month of November, we brought before you 42 contracts for a little bit over $122 million. 17 of those contracts had pre-contract goals for $74.7 million. Of those 17, we awarded to 4 prime vendors for $13.3 million and 9 subcontract awards for $18.4 million. So a total of 13 vendors, contract awards together for a little bit over $31.78 million and around the neighborhood of 43% participation. Also for the month, we had four waivers. Actually, well, there was 3. One of them was for time only. But so of those 3 waivers, we had a contract for service for maternal patient navigation service, $1.65 million, and courier services for the delivery of lab samples for $170,000, and then the renal biopsy studies, consults, conferences, and moderation contract for $149,000. So the 3 of those total up to be the 1.96 that you see here that garnered a full waiver with no participation. So looking all the way to the right and looking at the full year from December 1st of 2023 through November 30th, 2024, we brought before you 306 contracts total with a little bit over $1 billion. 104 of those, $820 million, had specific vendor-specific goals. 18 were primed, $21.8 million. 65 were subcontractors for $198 million. So 83 total during the year for $220.2 million, or a little bit over 27%. And there we had, during the course of the year, 21 waivers for $60 million. Any questions of the metrics? Oh, I'm sorry. And here, the next page is a visual of, with bar chart, the 43 for November and the 27 total year to full year.
Any questions for Charles? Hearing none, thank you, Charles.
Thank you.
We do not have any emergency purchases being presented. Items under the Chief Financial Officer. Pam, I believe, is going to first present grant award related items.
Good morning again. Pam Casera, Chief Financial Officer. Yep. No? No. Grant, sorry. There we go. Oh. All right, thanks, Debbie. Do have one grant award for you this morning totaling $4.794 million, and one extension of a grant as well. These grants are actually, I believe Dr. Kamapoli might have left, but Craig is here. That HIV one for $4.8 million is related to HIV services at CORE, if there's any questions. All right, hearing none.
Moving on, we're now going to go move to, is there a motion to receive and file item 5A, the grant award related items?
So moved.
Motion is made. Is there a second? Motion is made and seconded. Any discussion on the motion? Hearing none, all those in favor, signify by saying aye.
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 All right, now we're going to go to transfer of funds.
Yes, thank you. So we do have one transfer request this month. This will also go to the county board. It is item 251929 on their agenda. But this transfer is basically looking at taking monies from the from column, if you will, and putting to the to column. And the to column is primarily for supplies related to plant operations. Building maintenance has been having an increase in supply expense. That's the 5 million. Utilities expense has been greater than budget, 11,000. And then repairing equipment, 2.9 million. The last two items are a switch between budget lines, which we had to do. So I just want to point that out because of the opioid fund is like a grant, and we have to be very specific about what lines the monies come out of. And so it's just a switch you can see there from medical consultation to registry. As we are using or correcting the account, we're using registry RNs and peer recovery support specialists rather than physicians to perform that service. Any questions?
Any questions for Pam on the transfer fund items? Hearing none. Is there a motion to receive and file item 5B, the Cook County Health Transfer Fund?
So moved.
Motion's made. Is there a second? Motion's made and seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye.
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 Opposed? You guys have it. All right. Now we're going to move on to Pam's financials report. So
Yes, thank you.
this is an interesting day to be giving a financials report for reasons other than we've seen impacting healthcare up to this point. But these tariffs are also going to have an impact on the healthcare industry as we just went through all these contracts awarded, all these contract items that has to do with supplies.
Right.
Supply chain issues that we experienced during the pandemic. And as someone who can appreciate the necessity to strategically use tariffs at times, this full-scale assault on the global economy, I don't think is going to help our cause or the cause of American-made products. So that won't be reflected yet in the financials.
No, not yet.
So.
Not yet, but as I was walking in this morning and Sam greeted me and asked me if I had taken a look at my investment accounts.
Yeah.
I immediately ran to my office and looked them up. So yeah, bad times are coming, right? It's kind of the theme. But so this is for the first quarter ended February 28th. You can see we are unfavorable to budget both on a cash basis and an accrual basis. But as you just mentioned, Chair, these reasons are not reflective of the things that are happening or have just recently happened, right? These are more, and if actually, Debbie, you want to go to the next slide, we'll go through each piece. Starting at the top there, adjusted net patient service revenue, an unfavorable variance of 49.4 million. So net patient service revenue, again, is the revenue from the hospital and clinic side of the house. And that is primarily, the variances there are driven by whether or not we've had patients, right? Number of patients are meeting budget. And we're below budget on that. And we'll look at that on the subsequent slides.
Is it just the number of patients or how they're covered or not covered?
Both, yes. And we'll talk more about that. The county care side, though, you can see there's 77 million over on their revenue. Again, that's the membership driven, and their membership is still above their budget. So on the hospital clinic side, we're below budget on patient lines. On the county care side, they're above budget on membership. Then on the expense side, you can see we're under budget on salaries and benefits, and again, that's due to the vacancies. But then you can see we're over budget on claims expense related to the higher related to the higher membership. So all in all, a negative, excuse me, a negative 23.4 million. We budgeted basically to be just slightly positive of 2 million, so a 25.7 unfavorable variance to budget. Next slide. So yes, as we look at the volumes here, you can see, Stroger census is basically right at budget, but the ED visits and the surgeries are lagging behind. Now, when compared to last year, they're quite a bit behind compared to budget. It comes to like six emergency visits a day when you break it down to a day. So it's not a lot. Surgeries breaks down to like 5 a day, but they are lagging behind budget and prior year. At Provident, again, census is behind because we budgeted for 2 new observation units, a clinical a medical observation unit and a crisis stabilization unit, which have not opened yet, had not opened through the end of February. Emergency room visits behind, again, 1 a day, but they are behind budget, and then surgeries 2 a day. Primary care visits, I mentioned last month, will be behind all year because we budgeted a higher volume based on what we were seeing from the new arrivals. And then specialty care visits are just slightly behind budget. And county care membership, as I mentioned, still above budget. Next slide. So these graphs just extrapolate the first quarter projected, which you can see if the volumes stay this low, we will be significantly behind prior years. Now, we don't know if that'll, I think annualizing the first quarter, we typically do start out a little slower in the first quarter, both because of the holidays and cold weather, keeping people away from getting outpatient services especially. So we hope some of that'll correct in the second quarter. But, next slide, Debbie. As you mentioned, Director Harrington, there is also a shift in coverage, right? And also the fear, I would say, of the migrants or immigration issues, right, to seek services. So, the story here, we did add some of the prior years just so we can continue to show the story. You can see Medicare has been pretty flat, but we have seen, a 2% increase in the last few years. And also in commercial, right, very slow upward growth as a percent of total. So those Medicare and commercial, that's great. The Medicaid, though, what is really driven the good financial performance over the last several years was the pause on redetermination during the pandemic, and then the expansion of Medicaid to the immigrants. And so you can see now we're starting to see it was up on the Medicaid and a corresponding downward trend on the uncompensated, but now it's reversing, right? We're going down on the Medicaid and up on the uncompensated. So it's a combination, to your point, of volumes are down, but payer mix is changing as well. Next slide. Revenue cycle, a lot in the yellow here. Again, they still continue to work through their Change Healthcare issues with the AR. We're still working through about $38 million that's not reflected in our financials that at some point should come to us from the payers, initially denying claims that we're still working through that they shouldn't have denied due to timely filing because they were supposed to waive that and work to collect those monies. Next slide. Denials continue to be in the green. Again, trying to prevent the denial from happening in the first place. There's some, wavy lines here too, as it dipped above targets, but everything again coming back in line as they continue to work through. Next slide. And charity, as projected, again, we're just annualizing year to date here, but if this trend continues, you can see that the totals are projected to be higher than they've been, both what we budgeted and the last several years on charity and bad debt. Next slide. So these are some of the savings initiatives we're hoping to help offset those decreases in revenues. Revenue cycle initiatives all in the green there. County Care has a contract, care management contract that won't come into play until July. We gave that a green even though there's no dollars because that won't happen until later this year. And then the health system, $20 million is what we hope to achieve through the reduction of agency. And so, a quarter of the way through the year, we'd hope to be at $5 million. We're only at $2 million, and so we gave that one a red. And I know Craig and Wynn are going to give an update in their report on that. Next slide. And then County Care is at a loss year to date, almost $11 million. They're budgeted basically to be break even. The graph at the bottom shows their membership. Again, they're higher than their budgeted membership, but the light red is the HBIA and F membership, which we know the HBIA will be going away mid-year. And so, again, if we take away that lighter red bar off the top, you'd see they'd actually be below their budgeted membership. But when their membership goes down, their claims expense will go down as well. And so they feel that even when that happens, they anticipate they'll be at their budget, but at the end of the year, regardless of what happens to membership, as long as, you know, there's no catastrophic claims that drive bigger losses than they budgeted for. And that is my update. Any questions?
I know when we first anticipated, some changes, due to some people maybe not wanting to come out for in-person visits, we talked about beefing up capacity for virtual visits, and that being kind of one of the options. We can kind of drive, this in a more positive direction. Is there a breakout of that, or have we been looking at that? And are we beefing up the capacity still, as well as the ability to serve people virtually in different languages?
So it's out there, it's offered, it was advertised. We can certainly get a breakdown of the uptake. I know in general, the virtual rollout hasn't really gotten that traction that we were hoping for.
Not yet? Okay. I think watching that breakout might, you know, help.
Hearing no other questions, thank you, Pam.
Sure.
And now we're gonna move to, our monthly, report on our agency reduction plan, presented by Lynn Buren, we don't have Lynn's title down, he's the Chief HR Officer. I mean, he's really on the nose, Chief HR Officer, and our Chief Administrative Officer, Craig Williams.
Good morning.
You having fun yet?
Always. Never a dull moment, interestingly enough. All right. So there have been 669 offers made. From those offers, 545 have been accepted and 239 positions have been filled. This includes 82 internal candidates and 157 candidates who joined the organization. During the same time period, we've had 128 separations and an overall net gain of 128 employees.
This is overall or just on the agency plan?
This is overall right now. So this is just overall from 12/1 to 2/28. So based on these metrics, you'll see that there's a slight decrease from FY24 to FY25, same time period. As we're looking at our hiring trends, we've seen a decrease in new hires during that time period. Part of that is due to some of the agency onboarding we're doing, where we're pretty focused on that. At the same time last year, we also had, I believe we had accelerated hiring in place. So we'll see these numbers pick up in the next few months. Next slide. Current state agency.
Is the intent to, and I would assume the intent is, as the numbers pick up, because we're getting through all this work, is it to have the overall number exceed last year's overall number?
That is the goal. We'll be able to focus on overall recruitment a little bit better in the next few months, and we'll get into that when you see some of the agency numbers of where we're at right now.
Gotcha.
Towards the end of the slides.
So we've broken out, this was all on one slide before, we broke it out a little bit more, try to add a little bit more detail. What you can see is that we continue to see a pretty steady decline in the bars on our overall agency usage. So down to 1,179 agency FTE during the month of February. That's a 161 person reduction from September, which represents about a 12% decrease in agency. You did see a slight bump in, I'll remind you, in December, and that was really due to retirements and holiday coverage, really seasonality, which created that bump. February, we're down 45 FTEs, 4% from the prior month. And as we continue to innovate this slide, I did add in a calculation on the right, which is the line, which is our agency percentage. And I'm defining that as agency FTE divided by filled CCH positions plus agency FTE. So in other words, what percentage of our bodies on site every day working at Cook County Health are actually agency? So we're down to just a little bit over 16% on that measure.
Do you have a target goal?
So, I think the agreement we had around the agency settlements that we would continue to stay under 20%.
So you're under 20%.
Yeah, what we really want to do is make sure that we're not using any agency above and beyond what we have agreed with the unions, and we're making our way towards that.
Yeah, I would just add a line to show what the
Sure.
target is.
Yep, can do
So
it.
it's easy to see that you
I thought you all would have that number ingrained in your head.
But just for transparency's sake, there's some folks who want that to be 20% by department or by position.
Yep.
And so that number is not gonna be 16%, that number is some, and in fairness, and part of the debate about this is if we have like 3 specialty phlebotomist positions, I'm just pulling something out of the air, and one of them's agency and the other 2 are staff, you're at 33% agency usage. So, you know, that's there. I appreciate, you know, in big departments where we're over 20%, you know, that we have, you know, that we have a problem. But in some areas, there is some nuance to it where it's a very small position where you can get, the percentages can get out of whack real quick over someone quitting, something like that, or just a recruitment issue.
Yeah.
So.
Yeah, I would also say the complexity of our union environment and, places where we've had a hard time recruiting because of where salaries are, as an example, and having to collectively bargain that piece.
We're okay.
We need to get caught up.
I'll put a labor hat on for a second. We're okay with the wages going up. That sometimes,
Still needs to be bargained, right?
sometimes the process doesn't lend itself to that because you have a multi-layered function here.
Sure.
Commissioner Lowry has a question.
Thank you, Chairman. You know, your points are of course spot on. I think big picture, this is a really good story to tell to my colleagues. And as long as we're talking apples to apples, it's a very important percentage. And I want us to make sure we're shining a light on it, but also, as we've done before, make it clear that the work continues department by department. But this is a good report, and I want to applaud.
And I would still suggest that we should show the 20%.
Sure, absolutely.
Because it is, but I think that it's important to have a clarification about what that represents, and there will be some areas that will be much higher than 20%. But the goal remains the same, and the goal is to stay 20% or lower. Right.
Yeah, and overall, we're just under 16. Craig.
Unless you want to reduce the goal down.
Well, I mean, here's one thing that I think would be helpful. Right now, and maybe you have this later on, maybe this is something you can add. Right now, we're showing from September to February.
Yeah.
You may want to show a little bit more aging on that to show what the overall, because I'm guessing, I think there's, depending on how you talk about this, there gets to be confusion. But this agency number, even, as you'll see on this chart, we start below 20%.
Yeah.
And we had been below 20% before, but there was a time where I'm guessing we were above 20%, closer to 30%. So maybe I'm wrong about that number, but I feel like that's right. Maybe we could show some other historical data so people can see, because you didn't just start working on this in November. You guys started looking and studying and feeling the pressure on this earlier, so I think giving some more context would be helpful.
Yeah, absolutely. And we've made progress in HR with some of the things like advanced hiring and things like that. So, next slide, Debbie. So this just gives you the top 15 job codes that we are utilizing agency in the most. And you can see, if you certainly look at the last two columns, that February to September just measures the reduction by job code. And then really the last percent shows you, right now 34%, I don't mean pick on anyone, 30% of our agency usage is in nursing, and that's really reflective on some of the recruitment challenges overall industry-wide in nursing. But we continue to make progress on each of the job codes, and I think you'll start to see over the next 2 months as we are onboarding folks through the agency settlement, that we'll see even more progress on these specific job codes, most notably in building service worker, transporter, food service workers, and building service workers are prominent. We've already started to onboard those folks. So we'll continue to see these numbers go down in terms of agency usage on those.
So that last column is the total percentage that job title has in that 71%, that builds that 71% number.
So in other words, 397 clinical nurse ones, 34% of the 1,179 agency FTEs we have.
Okay. So, which is 16% of the total workforce that we're looking at.
Yes.
So what might be helpful for us as well to see where the issues are at is to have on this report showing how much agency utilization is for these top job code agency use. So
yeah, we could do that.
That I think would give us a guide to, where we're at overall, but where we're at by job code, and then we can deal with the nuance.
Yep. We're going to have so much more time on the finance committee agenda. It's great.
It's incredible.
It's going to be like a Bible we're presenting here.
I appreciate it.
I love all my reports here, for various reasons. You guys are like family. Craig, you're like the brother I never had.
Great.
Don't tell my brother I said that though.
Yeah, I want to applaud you for the work that you're doing, because you can't manage what you don't measure. And so this data is helpful in terms of helping us to really manage what we know is a problem. And some areas have a bigger problem than others.
Yeah. And I will note we did, per your request last month, we did add in the union group for these top 15, just so you can see where they are. See that?
Yeah, and it also tells us why we get, when people come to speak at the meeting, why certain groups are coming more than others.
I don't know, we get a lot of AFSCME though. Not a lot of NNOC, surprisingly. Okay, next slide is our focus on.
Don't answer the problem.
I know, I agree. It's like knock on wood. So this is our locum tenens utilization, so it's really provider utilization. I think the big takeaway here is we've cut down our provider utilization by a third from February to January. We're down 10 FTE locums, and you can see that's sort of across the board on physician assistants, physicians, APRNs. So continue to make progress in that area. Any questions on that? When?
Yeah. So I think this was the slide you were most interested in. So this data is a little aged because it goes to the end of February, but I can give you a quick update. So instead of the offers being 206, we're actually at 221 offers that were accepted. We added in 15 from AFSCME in the last few weeks. So with that said, we had 29 people start in February through the agency conversions, and then we had another 73 start in March. So the conversion's working. We have 41 scheduled for classes in April, and we'll see the rest go towards the end of April and then into May.
So the big spike happened in March, because that's when the biggest group of people were able to move through as we started the process.
Correct.
And
we'll see that increase as well for April until we get those 221 folks all the way through.
So April, that's 35 in the last couple of days, or
that's what we're projecting when the slide was made, but again, the slides are a little bit older. So
do you think that 35 number is going up?
That's going to go up. So it's actually already at 41, so we already know what's coming through, what's projected, and then we'll have some more towards the end of the month. So that kind of gets us through the first 2 weeks.
Okay.
Mark on.
And we're not onboarding any new agencies, so we're not backfilling with other agencies.
There are certain agencies that we've worked out to bring on in case of do a process, but it isn't. We've got that pretty well controlled. So there will be times where we have to bring agency in because of the business needs.
But you had a caveat on that last one. I don't think it covers everybody, but you go back to slide that. One more. All right. So but for the SCIU, RWDSU, ASME, and Teamster position,
I think we're gonna have to correct that on how that's written. We're bringing them on in certain cases after we've gone through and went through a business case of why we're bringing them on.
Okay.
Because in some cases, we're gonna have to, but the union has agreed in those cases to allow us to do that.
Okay.
So we have, like, there's a whole bunch of hoops we have to jump through to be able to prove that we need it. Like, what do we use it for overtime? Can we offer more overtime?
Well, I get it, but.
Yeah, we'll make
Yeah,
the correction
We
on
should
that.
correct that, yeah.
Yep. I
Mark?
appreciate you also correcting.
Hey, good morning. Good morning, colleagues. Good morning, directors. Pleased to report a quick update on the Hectone transition. I'll do this in kind of two parts. So part one is, we embarked about 11 months ago on a transition of all of the grants that sat at Hectone to get them over to CCH. I'm pleased to report that all of the relinquishments have been approved. All of the transfer applications have been approved. We're just waiting for a couple of notice of awards at this point, which are expected, today or shortly thereafter. So it's a huge accomplishment. We were able to kind of, achieve the transition of the awards themselves. The second part of the transition involves the people that were funded by those grants. And as you know, there were a lot of people, and a total of 112 folks received, notices from Hectone that, their employment would be ending. We were able to leverage MedX to make offers to all of those folks. A total of 97 ultimately accepted offers of employment at MedX, and that's where they sit today. We're working closely with our partners in finance and HR to post positions that these folks sitting at MedX can apply to so that we can get them from MedX to CCH. We expect to have all of the folks transitioned or at least offered positions by the end of June. And I look forward to reporting progress on that second part of the journey over the next few months. Any questions?
Yes, thank you. You said all of the awards that were scheduled to be transitioned, all of them have been approved.
Correct.
That's great. Thank you.
Thank you.
All right. Well, no other questions? Thank you, guys. We'll see the updated report with the updated metrics, and nuances next month, and keep plowing forward. Well done. Having received that report and exhausting the agenda, we are adjourned.
Thank you.